So one of my favorite populations as a pelvic floor therapist to work with is 65 plus experiencing urinary incontinence. I think a lot of times for, let's just say even 50 plus, if a person, man or woman, is experiencing incontinence, we're told it's normal, it happens, it's part of the aging process. And sure, while there is some truth to that, I guess, there's also help that can be had. A lot of times it's a pelvic floor issue. Your pelvic floor is internal. We can't see it, and we often don't think about it. And a lot of times those muscles in the pelvic floor throughout your lifespan, they get weak, or they can be too tight and they get forgotten about. And then all of a sudden in your older age, when it should be the prime of your life, or just after the prime of your life, as you're settling down, you can begin to have some incontinence issues, peeing or pooping. And there's hope. There is a lot of treatment that can be done beyond just like a surgical intervention or just putting a diaper on to band-aid the problem. We do a lot, or what I do specifically is a lot of mindfulness-based training. It's allowing that person to feel those muscles again for the first time, probably in a really long time, to begin to understand what the role of those muscles are. Think about your shoulder. If your shoulder had an injury or something was going on with your shoulder, it would be very easy to rehab it because you can feel it, you can see it, you can move your shoulder. It's harder in the pelvic floor. It's a little bit more intimate. Mentally, it can be pretty taxing to be experiencing this issue that you don't want to talk about with people. You don't want to tell them what's going on. Seeing a pelvic floor therapist, we get it, we understand, and we have the tools to be able to help. Through a lot of mindfulness training, there's a lot of research about urinary incontinence with mindfulness training specifically, and that's where occupational therapy, we really thrive because we understand the aspect that it can take, or the impact that it can have on you psychosocially, so mentally, and there's hope for you if that's something that you're experiencing.